Hi, this is Trey Jones for Senior Benefit Concepts, and in this video I'll show you how to find the Part D drug plan that's best suited for you based on the prescription drugs you're currently taking. Then I'll show you a few ways to easily enroll in that plan. Let's get started. The fourth and final part of Medicare, Part D, is your prescription drug coverage. The best Part D plan for you is one that covers all your prescription drugs at the lowest overall cost. And the easiest way to identify this plan is to use the comparison tool found on Medicare's website, which is www.medicare.gov. And now I'll show you step by step exactly how to do this. Okay, so this is what Medicare's homepage looks like. And in order to use the drug finder tool, we're going to click this first green tab, the one that says Find Health and Drug Plans. And that's going to bring you to this page, the actual plan finder. Now, the availability of these Part D prescription drug plans is determined by your zip code, so you're going to need to enter that here. And once you have done that, come down and click the brown tab that says Find Plans. And that is going to bring you to this page where you're going to need to enter some information. If you're turning 65 and you're new to Medicare, you're going to select the original Medicare. It says, how do you get your Medicare coverage? Select original Medicare. And then if you come down, it'll also ask you if you get any help from Medicare or your state in paying for your prescription drug costs. And we are going to select, I don't get any extra help. And then come down here and click the brown tab that says Continue to Plan Results. Now, that's going to bring you to this page where you're going to need to enter some information about the prescription drugs that you're currently taking, and you'll need the plan or the drug name, the dosage strength, and how often you take it. It is a really good idea to have your prescription drugs close by, or at least have a list of your drugs that you can refer to. And so what we'll do is we'll enter a common generic, we'll enter simvastatin. And you can see as I start typing that it populates right here, so you can click on, if it populates the correct drug, you can click the drug name or you can continue typing. And once you are finished typing the name of your drug, come over to the right and click the tab that says Find My Drug. Now, when you do that, if there are several different forms of the drug, for instance, a generic or a brand name, it'll list all the forms of that drug. So make sure you look at your prescription bottle or your prescription drug list and just make sure that you're adding the right drug. And once you've done that, come over and click the tab that says Add Drug. And then it's going to ask you for your dosage, and we'll pretend that we're taking 10 milligrams, and then it's going to ask you to enter the quantity. Now, the quantity is the actual the amount of medication you get every time you have your prescription filled. So we'll leave it at 30, as in 30 pills, and then it'll ask us about the frequency. And what it means by frequency is how often do you have the prescription filled, and we'll leave it at every month. The pharmacy type, most folks are used to just walking into a drugstore pharmacy, and so we're going to select, I get this medicine from a retail pharmacy. And once we've done that, we'll come down here and click the brown tab that says Add Drug and Dosage. And that will bring up your personal drug list, this drug list. And you'll need to do this, you will need to go through this process for every prescription drug that you're currently taking. One other thing to note, if for some reason you can't finish the process after you've started it and gotten this far, just make sure that you copy down this information, your drug list ID, the password date, which is just the date that you created the drug list or modified it, and you'll also need your zip code. Otherwise, if you have time to continue, just come down and click the brown tab that says My Drug List is Complete after you've added all of your drugs. And that will bring you to a page where they're going to ask you to select your pharmacy. So based on the zip code that you entered, it's going to give you all the pharmacies inside looks like a mile, inside a mile radius. So we're just going to pretend that we're using CVS, and underneath the address and phone number, you can see it gives you an option to click Add Pharmacy, and we're going to do that now. And that actually now brings CVS up, and that is our selected pharmacy. So once you have selected your pharmacy, come up to the brown tab that says Continue to Plan Results and click there. Okay, now to see all the available standalone prescription drug plans, we're going to make this first selection, prescription drug plans with original Medicare, and we'll do that just by clicking this box and coming down and clicking the brown tab that says Continue to Plan Results. And now first it's going to list original Medicare. It's going to tell you that you currently have original Medicare, which to enroll in a Part D prescription drug plan, you will have to have either Part A or Part B of original Medicare. But if you scroll down, it will have the list of prescription drug plans available in your area, and it will have them sorted by, it should have them sorted by the lowest remainder of the year retail costs. Okay, now most of these plans are a little bit different in terms of monthly premium amounts, the amount you have to pay for your drugs, your drug copays or deductibles. But this number right here, where it says cost as of today, that cuts through all that and just gives you a really good, accurate estimate of what your cost should be depending on your drugs through the remainder of the year. Another really important detail to note is whether or not all your drugs are covered, and you can find that out by looking at the detail that I'm circling with my mouse, where it's going to tell you whether or not all your drugs are listed on the plan's formulary. Now, the formulary is just the plan's list of drugs that they cover. Once you've made a decision on your drug plan, the next step is to enroll in that plan, and you can do that in two ways. First, each of these plans, as you can see, has an Enroll tab, which is to the right of the plan's information, and if you click on that, this will take you through the plan's enrollment process. Now, first you're going to need to have a valid election period, and if you're new to Medicare, you're going to have 3 months before your Medicare effective dates and 3 months after your Medicare effective dates to enroll in a drug plan. So you'll scroll down, and it'll show you all the things that would allow you to enroll in a drug plan, and then you'll click the tab that says Continue Enrollment. That will bring you to the Start Enrollment, and if you're turning 65 and you're new to Medicare, you guessed it, you're going to click the box that says I am new to Medicare. And then you're going to scroll down and click the tab that says Continue. Now, this is where you're going to begin to enter your personal information, and you'll do that and just follow the prompts on through enrollment. Now, the other option, we'll close this. The other option is to contact the plan directly by phone, and you can find their contact information by clicking on the plan's name. So we'll just click on this first plan, Silver Script Choice, and when we do that, that'll bring us to a page that gives us the contact information for the plan. And the best way for you to contact the plan is to use the number listed for non-members. And just remember that before you enroll in a plan, whether you use the phone number or you click on the Enroll tab to go through the automated enrollment, you will need your Medicare card, your red, white, and blue Medicare card. I hope you found this video helpful. If you did, you can subscribe to our channel by clicking here, and you'll receive new Medicare videos as they come out. If you've watched all the videos in this series, then you probably have a much better understanding of your Medicare benefits, and you can now focus on your personal supplementary coverage, which is what we specialize in. Our office can be reached at 1-800-520-5560. And remember, we're independent, unbiased, and our service is completely free. Thank you for your time, and I hope you have a great day. Bye-bye.